Thank you again for joining us for another video on Medicare education. Today's topic is managing your Medicare and why it's important that you pay attention to the different types of Medicare plans that are available. My name is Keith Knabb, and my company is Affordable Medicare Solutions. We're the largest provider of Medicare education services in Georgia. We're also the largest Medicare planning agency and the highest awarded one. We are in Suwanee, Georgia, myself and 8 employees, soon to be 9. And we are available for free. There's no charge for our services year-round. But let's get to today's topic. Today's topic is managing your Medicare, and this is a generalized summary. And we have multiple videos on many different subjects, and I'm going to touch on some today, but you also would want to go back to the YouTube channel to get more in-depth on some of these matters. This is the big thing for you to take away today. Medicare is not set it and forget it. Just remember that. It is not set it and forget it. It can be a big mistake if you just let your Medicare roll year by year and not pay attention. You're going to lose choices under your access to healthcare, but also you're going to lose money financially by not taking care and finding the best priced plans that have the lowest cost drugs and other issues. So each year you can do this, and the yearly changes can be done in the end of the year annual enrollment period, which is in October 15th through December 7th. But what can change for the upcoming year is your out-of-pocket costs, how much you're going to spend if you get sick to get better, such as your deductibles, such as the cost for your medications. And how about this one? Which doctors you can see and which pharmacies you can use. And on top of that, now Medicare has added new programs for those people who have become low income or have developed a chronic illness. Let's get back to basics a little bit here to remember that Medicare has changed and has 2 ways of accessing Medicare: the traditional classic format of Medicare versus the modernized format, which is the new modernized Medicare health plans. And this has been happening since 2005 over the last 15 or 16 years. These differences between the 2 plans are pretty significant. And we have an ebook, electronic book we can email you, and also educational flyers beyond these videos that you can download to learn even more, easier than reading the full Medicare book. Basically, with traditional Medicare, you're prepaying for your health care, your medical events, by buying an insurance policy that does the work for you. With the new modernized Medicare, it is basically paying as you need care, pay as you go. And when you need care, you pay. That's fine. But just knowing you have to have money set aside to do that. However, with this new modernized Medicare, the great trade-off is that they're adding thousands of dollars, lots of extra benefits in those plans to help you along the way. So what is this little insurance policy that you can get with traditional Medicare? It is called a Medigap or Medicare supplement, and is a very simple, small miniature insurance policy that pays for what Medicare leaves behind. It's very efficient, very effective, very popular. I have thousands of clients that use these programs, and they run about $120 a month to maybe $230 a month here in Georgia. And they make no decisions. The supplement makes no decisions on your health care. Medicare does. The doctor and hospital are dealing with Medicare, and then Medicare is instructing your supplement to pay the rest of the bill. It's an electronic clearinghouse. So the supplement doesn't do any interaction with your healthcare to make decisions. And your coverage does not change throughout the entire United States. You can use it in Puerto Rico or Hawaii or Alaska, and it doesn't change. And some of the Medicare supplement options, 2 of them, provide international coverage. And that's helpful if you're a traveler. But what is this new thing called Medicare Advantage? Medicare Advantage is the new modernized side of Medicare introduced in 2005. And this is where it's very similar to what people had when they were working. Plans such as HMO, which means Health Maintenance Organization, or mandatory network plans, or the flexible and easy to use PPO plans, which are preferred provider options, which means you can use the network of doctors and hospitals, or you can go outside the network. It's your choice throughout the entire United States. There's lots of other little categories under this We don't have to spend too much time on it today, but there's other categories for people with special needs. That's SNP, special needs plans, or the new Medicare savings accounts, where you actually have a high deductible and you save money towards your Medicare. You can also, on all these plans, the plans have optional benefits that they decide, Medicare does not mandate, such as dental or vision or transportation benefits or hearing aids, meal delivery to your home, or food coupons or food credit cards that provide you free food at the grocery store. Over-the-counter items, medical items, same things that you put into your medicine cabinet, they will send you for free. Q-tips, Band-Aids, Vaseline, feminine items, adult incontinence items, etc., for free. You can join these plans with your pre-existing conditions because there are no health questions. They don't ask whether or not you smoke or what your weight is. They just no health questions at all. And you can typically only change these plans during the annual enrollment period, AEP, or the open enrollment period, which is the first 3 months of the year, January, February, and March. So it gives you quite a bit of time to make choices and make changes. Now, if you do have other things that happen to you during the year, such as moving to a new home, you can also manage and change your plan during that time period. And we have a video on those enrollment periods to help explain that in more detail. But let's look a little bit more so you understand the differences between the supplements and the advantage plans, because managing your Medicare is understanding these differences. If you have a supplement, I had said you prepay for your health care. Remember, you can go to any doctor that accepts Medicare nationally, but they're going to be more expensive because you're going to have to pay a premium for those plans each month and every month. But when you go to get health care, you're going to have nearly 100% coverage where you don't have to pay when you get sick. So that's different from the Advantage system. The Advantage system, it was where you would pay when you do get sick. You pay as you go. And you would first look at your provider network, and you would then choose, or you would go outside the network if you have a PPO option, preferred provider option. But most of the Advantage plans have a 0 premium per month. So you don't pay each month to have the plan, but you're going to pay copays when you go to the doctor and to the hospital and to the MRI center to get some scans done. So it's not 100% coverage. You're going to pay copays, not deductibles, but copays when you get sick. But you do have an annual out-of-pocket maximum, so you don't have to worry about runaway medical bills. And under the Advantage programs, they're popular. About half of my clients use them. That is where you see the extra healthcare benefits that we talked about: dental, vision, hearing aids, but even more than that, gym membership or payments for doing your preventive care or well care visits. The over-the-counter medical items, they'll ship to you. Meal delivery. If you go to the hospital and come home, most of the plans now are bringing you food to your home. But some very few plans are also experimenting with some new benefits, such as home care assistance, someone to come in and cook or clean, or maybe to provide adult daycare or transportation to get you to the gym or to the doctor or to the pharmacy. Those are new benefits. And if you've seen Joe Namath on TV, he's talking about get your extra healthcare benefits under Medicare. Now, there's more to that Medicare for all people in Medicare are also providing extra help, especially for low-income people. So they'll provide these if you apply. Now, if you receive Medicaid, a lot of these programs will be automatically assigned to you. But if you don't qualify for Medicaid, you have to apply for the extra help programs through Social Security. An example of this low-income help is premium support for your drug coverage. So Medicare realizes if somebody's low income and they can't afford a drug plan, let's give it to them for free, up to $33 per month. And then if somebody can't afford to get their drugs at the pharmacy, let's lower the cost. If their insulin is $200 a month, let's bring it down to around $9 per month. Each year, these numbers change slightly by nickels and dimes, but they do change a little bit each year. And they also eliminate the deductibles under the drug program, eliminate the donut hole and those extra irritants in the program for the low-income people to make it easier to use. Still, if people cannot afford their drugs, the pharmaceutical companies have also stepped in to provide help. So if you have a high-cost medication, call your manufacturers. They have patient assistance programs. But also, independent companies have created savings programs called GoodRx or other competitors that'll help you save money on your drugs if it's still not affordable under your Medicare drug program. Can't use both your drug program and the coupons, but you can use one or the other, and that's fine. Medicare says it's okay. Now, the next thing for managing your Medicare is that everybody in Medicare needs to create an online portal login and password at your Medicare.gov account. So it's easy. Once you do this, you can print out temporary ID cards. You or your family can see the status of the Medicare plans that you have. And you can also analyze and select new Medicare plans, such as drug plans, every fall during the annual enrollment period in October, November, up to December 7th. So how do you do this Medicare account? You go to Medicare.gov and it says log in or create account smack dab right in the middle of the page. Just click on that purple or blue button and you click there and it says create one now, and you do it. It's very simple. Take you maybe 2 or 3 minutes to put in your Medicare ID number, your email address, your name, and your zip code, and some other information. You're ready to go. And store that password so that you don't forget it. But if you have to reset it, it's not hard to reset. It's pretty easy. So why do these annual reviews matter? Once you create your Medicare account and we're helping you, or you try to do this on your own, what you do on an annual review is you're first making sure that your drugs and your pharmacy are covered next year. You don't want to walk into your pharmacy and find out your $200 a month blood thinner is not covered. That's a bad mistake, and you want to make sure that it's covered. But you also want to make sure that your doctor and your hospital are on your plan if you have a plan that has a network. Of course, if you're on a traditional Medicare, just make sure your doctor is going to continue to see you under regular Medicare. Now, I make sure that my clients are not being overcharged. It's hard for the consumer to really do a lot of investigation to see if they're being overcharged. But I have my finger, and my staff has the finger on the pulse of the market, and we know which plans have gone from $20 a month to $40 a month. And we know that the average price might be at $20 or $25. And if somebody says, hey, my plan has gone up, we can tell them pretty quickly if they're being overcharged. There's also things that we hear about that the average consumer never hears about, which are our new Medicare rules. And they revise these all the time, especially when there's been a new president comes into office and you have new administrators at Medicare. They start to revise the Medicare rules. It's impossible for the consumers to keep up with those. And you need to tell your Medicare agent, you need to tell me or my staff if anything's going to happen. Are you going to move? Are you getting ready to put in 2 new hips? Or have you been diagnosed with cancer? We need to know to help you to manage your Medicare based on any upcoming life events or healthcare events that are getting ready to happen. So are all Medicare agents the same? No, most are set it and forget it. And that's what I said to you earlier, is that Medicare is not set it and forget it. Most agents just want to write you a plan and never talk to you again. Only a very small percent, 5 or 6% of agents actually provide true customer service, annual management, year-round advice and service. It's expensive to do. And if you only have a few clients, you can't afford to do that. But if you have thousands of clients, you can afford to do it. Only use a Medicare professional that will show you all the options and not just a select few that they feel comfortable with. Make sure that you are with an agent that represents the entire market. And then the last one's super important. Only use a Medicare agent that provides all of their services at no charge to you. Make sure you don't pay a Medicare agent for a review. Now, our website is fantastic. If you're an internet person, go right there to amsplans.com. You can download free information. You can see when we're going to be doing public speaking events. You can also get linked to our YouTube channel. And our YouTube channel has these videos, and you're already watching one of them now, but we're adding to them all the time. And you can go back and re-review them at your leisure. I'm very proud of the work we've done on our YouTube channel. So thank you very much for joining us today. Our phone number is 770-945-5261. And you can, of course, request copies of this presentation, but you can also call my office and just say, hey, I want to do a free review, make sure that I'm on track with my Medicare, and my staff will help you at no charge. Thank you very much.